Hi, I'm Rachel Emery. I'm one of the nurse practitioners here at Logansport Memorial Hospital, and I currently work in the Women's Health Center as a nurse practitioner, seeing patients, mostly pregnant patients, but seeing patients across all age spans. Postpartum depression is a part of a variety of perinatal mood and anxiety disorders, and generally it's caused by hormonal changes either during or after pregnancy for a lot of women. Sometimes those can also be hormonal changes that occur just during a normal cycle. And so a lot of women will experience mood disorders or anxiety disorders during their regular cycles. And if you do experience that during a regular cycle, you're more likely to have postpartum depression or anxiety, either during your pregnancy or afterwards. Postpartum depression is typically something that is diagnosed after 2 weeks postpartum. For the first 2 weeks postpartum, there's something known as baby blues that happens to almost every patient. Not every single patient will experience it, but it is something that you can be mindful of and to watch for. You can be very tearful, even if you're happy. I remember with my first son, I would cry about anything. I would see a commercial. There was a particular Downy commercial that was on at the time, and I would cry every time it came on. And my husband would be like, "Why are you crying?" And I would say, "Because he's growing up so fast." And he was only 2 weeks old. But that was more of a postpartum blues type of experience. And generally what we say is the postpartum blues should not last longer than 2 weeks. So if it lasts longer than 2 weeks, then we're looking at a postpartum depression or postpartum anxiety. So postpartum psychosis is a whole different beast, and it is different. Postpartum psychosis is not postpartum depression. It is not postpartum anxiety. It is a little bit scarier than those two. Postpartum psychosis is when you might be having thoughts that are not normal. We've had patients, not here, but through PSI and stories that I've heard of patients telling their practitioner, "Oh, look at this baby, she has look at her eyes, they turn like gold sometimes, and see how that happens. I think she's connected to God or something." And we've had patients come up with these wild stories, and it's just all in their brain where they're experiencing a psychosis. Now, postpartum depression and postpartum anxiety are not postpartum psychosis, and that's something that I want to make clear because a lot of people don't differentiate between the three things. Most patients have either postpartum depression or postpartum anxiety. It's a lot smaller of the population that has postpartum psychosis. Postpartum psychosis would be when you're having thoughts of hurting your baby or killing your baby, and that is scary, obviously. And so you need emergent treatment if you think you are experiencing postpartum psychosis. That'd be something that you go to the emergency room for, make sure the baby is safe or with somebody else, and you can go to the ER and receive treatment for that. Just because you experienced that does not mean that people are going to think you're crazy or label you as psychotic, and there are treatment options that can help. And it doesn't mean that because you've experienced postpartum psychosis one time that you're going to have it again. So it really is, it's kind of it's definitely more rare than postpartum depression, but it's important to differentiate because a lot of people just associate postpartum depression with people who kill their babies or people who hurt their children or their families or themselves, and that's not always the case. If you are experiencing any suicidal thoughts or thoughts of hurting others or yourself, you need to go to the emergency room right away or call 911. That is something that is serious, and we don't want you to hurt yourself or anyone else. So we would prefer you get to the emergency room, and then we can work with the ER staff to kind of get you in the right place and get that figured out so that you don't feel like that anymore. It can range across the span for everyone. Everybody's a little bit different. With depression, sometimes it's sadness or crying a lot. Sometimes it's just not wanting to get out of bed. Sometimes it can be that you don't feel like you're bonding with your baby. I've had patients say, if a person was holding my baby, sometimes I just am like, okay, you can just have him, and I'm good. I'm sitting over here by myself for a while, Sometimes the anxiety symptoms are that you don't want anyone else to hold your baby. You want to be watching your baby all the time. Sometimes you might not be able to sleep because you're watching your baby sleep to make sure they're okay, or you're fearful that something is going to happen to them while they sleep or while you sleep. Another major symptom of anxiety is rage that can sometimes come across. Some women are just very angry and they feel like it's almost like you can't tell why you're angry and you don't know how to stop it. And you can even rationalize, and you're thinking in your head at some points, why am I screaming or why am I yelling? Why am I so upset? This is ridiculous. But you can't stop it. You can't stop those thoughts of just being so angry. Every pregnancy is different, every baby is different, and every postpartum experience is just a little bit different. I personally had 3 very different postpartum experiences, and my pregnancies were all very similar. So you just have to be careful with comparing yourself to another person because everybody really does have a different experience. Some of the newest research is saying that postpartum depression or anxiety can start anytime in your first 3 years postpartum. So it was previously thought that these symptoms could start or manifest at any time from the birth of your baby until your baby turned 1 year old. However, now we're finding that it can really start any time in those first 3 years of your baby's life. And what's happening during those first 3 years is that maybe, you're pregnant and then hormonal changes right at delivery, and that continues over the next 6 weeks while your body gets back to quote unquote normal, okay? And then during that time frame, you may or may not be breastfeeding or stopping breastfeeding, and then there's another hormonal change during that time. And so that can happen at any time. Some people will breastfeed for 6 months, some for a year, some for 2.5 years, some for 3 years or more. So it really is different and specific to every patient. But that's what we're finding is that it can start and stop a lot longer than we initially thought. And then now we're seeing that there can even be changes before baby's even born. And sometimes pregnancy itself and the hormonal changes associated will trigger a postpartum or a perinatal depression or anxiety. So I'll just share a little bit of my experiences. I actually experienced postpartum anxiety after my first child was born, and I did not realize that I had postpartum anxiety until my second child was born, and I felt normal. And I had a wonderful OBGYN. I had a wonderful pediatrician that took care of my son, and I was screened at every visit. They gave me the depression screens, and I knew what I was supposed to feel like, so I was answering the questionnaires correctly, but maybe not how I was feeling. I even had my sister-in-law ask me at one point. She said, "Hey, are you okay?" And I was like, "Yeah, I'm great, and all my questionnaires have been great." And she was like, "Okay," and she knew before I did, I think. And my mom just told me recently that, in talking about postpartum depression and anxiety, that after I had my first baby, she remembers an incident where we were up at our family's lake house, and there was a tree that needed to come down that was getting ready. It was probably going to fall down if it didn't come down, and it was supposed to happen the next week, and there was a storm while we were there. And she said she remembers that I was so anxious and like not wanting to be away from the baby because what if the tree fell while we were asleep and killed us all, And that was not a rational thought process. And I didn't even remember that. I did not even remember that occurred. But she said even with that, she never thought, oh, you have postpartum anxiety or depression. I felt happy. I was so happy to have a baby. I'd wanted babies my whole life. So I was happy, and I thought because I was happy, I was fine. But it turns out that after I had my second baby and I actually felt normal and joyous and not anxious, I thought, oh my gosh, I had postpartum anxiety last time and I did not know it. So it was pretty mind-boggling that someone who has worked around postpartum depression and done research projects on postpartum depression could even have it myself and not realize it. We started in our office, it's probably been almost a year ago at this point. We started screening every pregnant patient at their first visit, and that's your OB talk with me. And we screen you there, and then we screen you at least 3 more times during your pregnancy, so once a trimester. And then after that, you are screened postpartum up in labor and delivery, and then you're screened again at your 2-week incision check if you have a C-section or if you come in right after delivery. Then you're screened again at your 6-week postpartum check. And in addition, in our pediatrician's office, you're going to get a questionnaire every time you bring your baby in until they turn 1. So at their 1 week or 2-week visit, their 1 month visit, 2 months, 4 months, 6 months, 9 months, 12 months, you're getting a screening at all of those. All of those screenings come back to me. So then I'm going through them, and if anybody is flagging high, what I do is I follow up with you. And sometimes that's sending a message to one of the LPNs or MAs to call you and say, hey, how are you doing emotionally? How are things going? Would you like to schedule a telehealth or an in-person visit with Rachel to further discuss this? And sometimes patients say, no, you know what? I'm doing great. I feel great. I think I'm better, especially that happens a lot with patients who are maybe just experiencing a baby blues and then they're feeling better all of a sudden. But we kind of watch the trends too. So if you scored a low score and then all of a sudden your score is very high, then I'm probably going to say, hey, what's going on? What can we help you with? Is there anything that's changing in your life or socially for you that you need help with, or what's going on? So if you have postpartum depression in one pregnancy, then I always tell patients that if you experienced it before, you are maybe a little more likely to experience it again, but we're going to watch for it, Maybe the first time you weren't treated because you didn't really know you had it or you didn't know what it felt like. And so we're going to watch very carefully. And I always tell people, let's, even if they want to come off medication during pregnancy or they feel like they're doing okay during pregnancy, then we're going to say postpartum, let's meet right after. Let's maybe do a telehealth a week after delivery to see where you're at and how you're doing. If you're great, then that's great. And we'll just kind of still follow up according to our regular schedule. But if not, then we'll follow you a little more closely and maybe see, if you need help again. As soon as you feel like there might be something going on, you should call. We are happy to see you at any time, whether that's even if it's before the 2 weeks. If it's before the 2 weeks, but you're feeling very sad, very anxious, and you feel like this might not go away in the next couple of weeks, give us a call. We're happy to squeeze you in. I'm always happy to squeeze patients in. We also have telehealth available, which makes things a lot easier for new mamas with newborns at home sometimes. And if you have depression, you might not want to get out of bed or get out of your pajamas. So, just give us a call, schedule a telehealth appointment. We will find a time that's convenient for you, and we can schedule that. It's really easy. All you do is at the time of your appointment, you get a link on your phone. You just click the link and my face pops up and we're right there ready to help and talk about it. Sometimes the appointments last 5 minutes. Sometimes they last 20 minutes, sometimes a little longer, just depending. And then we can kind of develop a plan for how we want to do this. That's not always medication. Sometimes you call and say at 1 or 2 weeks postpartum that you want to talk about it and kind of stay ahead of things. We say, okay, let's talk about it. You don't really feel like you need medication yet, but maybe you want to discuss behavioral health therapy or something where we can get you into therapy and talk to somebody a little more regularly. Sometimes you just follow up with me every couple weeks until that 6-week postpartum visit. Sometimes at 2 weeks, we start you on a medication, see how things are going, and then by your 6-week appointment, we reevaluate and see how that's going for you. And there's, if it's not working, then we maybe switch it or change it to something else. So there's lots of options, and the sooner you call us, the sooner we can help you. The goal of being on a medication is to make you feel more like yourself. For some people, that means taking the medication for 3 months and then weaning off of it, and they're fine. I always recommend not weaning off medication either before the winter or before cold weather months, because a lot of times, especially in Indiana, we have seasonal depression that will rear its head. And even for people who never had anxiety or depression in the past, once you have, some feelings of depression or anxiety, or postpartum depression or anxiety, you're going to be more likely to have a seasonal depression too. So I would say, I always tell patients, don't stop the medication without talking to us. Talk to us first. I've had patients for all kinds of medications say, oh, well, I felt better, so I stopped it. Well, you felt better because you were on the medication and it was working and doing its job. So stopping it is probably not the best idea. But usually, our goal is not to keep you on medication forever. Our goal is to find a place for you where you feel like yourself and you are happy and satisfied with your results. So for some people, that's being on medication for a few months. For some people, that's being on medication for 6 months. For some people, that's being on medication for a whole year until their baby turns 1. Sometimes people will be on it and then they're off of it for a while and then they have to take it again at some point later in life. It's really is different for everyone. But again, our goal is to make you feel more like yourself and get you to a place where you're satisfied with your treatment. So the goal is not to keep you on medication forever. There are safe medications for you to take while breastfeeding, and we definitely look at the whole picture. We're not just going to say, here, take this medication. What we do is we kind of look at your whole clinical picture, look at what your pregnancy was like, look at your history, whether you've had any anxiety or depression in the past, look at your family history, what all could be going on here. And then we tailor the treatment to you. So it's not like, oh, we just start all the patients on this one medication. It's very much tailored to you and what you need. And we definitely take breastfeeding into consideration because we would love for you to continue breastfeeding if that's possible. I know how I felt when I had postpartum depression and anxiety, and postpartum anxiety with my first child, absolutely nothing with my second, and then with my third I had postpartum depression, and it was much more of a depression than an anxiety that time. You have to be honest with yourself, with your provider. It really is important because we're just here to help. We really want to help you. We really want you to feel like yourself again. One of the biggest things I remember talking to my OBGYN at my 6-week postpartum visit with my daughter, who was my third child, and I said to her, I said, I either need to be on something for anxiety or depression, or everyone else around me does, because they are all driving me crazy. I need something, or we're gonna have to figure out how to put everyone else on something. And she said, Rachel, this does not mean you're a failure. This does not mean that you're not a good mom. This means that all we want to do is make you feel more like yourself. We want you to feel like Rachel, who is not depressed and not anxious. We want you to feel like how you felt before you had this baby and how you were joyous and excited for her to be here. We want you to feel like that again. And that was a big moment because I thought, wow, that's a really good talking point to say we just want to make you feel more like yourself. We're not trying to drug you and make you feel numb. We're not trying to make you not have feelings. We just want you to feel more like yourself. And sometimes that just means bringing your anxiety down a notch to help you feel better. Tell people that you can't take care of your baby well if you're not taking care of yourself. And that's a big point, and that's a lot to unload in your own brain, because a lot of us think, no, I'm fine. I'm just, I'm taking care of this baby. I'm okay. But if you're not doing self-care or taking care of yourself and your own emotions and your body, then you really you can't be a good mom, because there's constantly going to be that in the back of your mind. So I think support groups are great because talking to someone else who has been through this is huge. It's almost like a weight off your shoulders. Like, yes, that's exactly what I've been experiencing. Oh my gosh, A lot of times I'll share my own experiences with my patients just to say, you're not crazy. This happens. This happens to people. You're not crazy. This is all hormonal, or this is all a part of what's going on right now, but we will get you to a place where you feel like yourself again. I think the support groups can really help to facilitate that, because you're not just talking. It's not just me that you're hearing from, or not just a behavioral therapist that you're hearing from. It's other people who are just like you, moms, stay-at-home moms, or working moms, or anything in between. And dads can experience postpartum depression and anxiety too. So that is super important to note. I've seen it where dads are having just as hard of a time as mom, or sometimes even a harder time than mom, and that is totally normal. There's been lots of research done on that, and adoptive parents as well. Adoptive parents can feel postpartum depression and anxiety or perinatal mood disorders as well. Primary care would be a great place to start. They can definitely help to facilitate that. PSI also has a lot of resources. So that's Postpartum Support International, and they are an organization that has lots of support groups. They have Zoom support groups for almost everything you can possibly think of. There's a whole list on their website, and I believe it's postpartum.net is the website. There's lots of resources. You can even plug in your zip code and they give you local resources. It really is a great website and a great organization, and they really have a lot of resources for dads. We are all here to help you at the Women's Health Center. We really want you to be kind to yourself, and we want you to know that you're a good mom and you're doing a great job, and we are here to help. So anything that we can do to help you, please let us know. We have lots of resources that we can share, and we really want you to have a great experience.